wonderful sight to see each of you with us here, because we know that you are gathering the data, you're listening to the stories, you're helping both the Democratic Women's Caucus and America understand what is at risk and what we are fighting for in this shutdown, right? And I think it's really important to focus on those issues so that we don't get caught up in the small battles that happen every day, that we do not get lost in the misinformation and disinformation, what I call lies, right? There's no other way to describe their version that we are doing this for undocumented immigrants out there, because we know they don't get health care, but we know who does rely on the health care that we are talking about. And we know that it is women who are disproportionately impacted, which means that they have the hurt. That, we say disproportionate. What does that mean? It means women will hurt and will suffer. Not just in terms of their own health care, but because women are the decision makers in their families with regards to how do they budget and how do they decide what they do. 80% of the households, women will be making those decisions. So when we think about the decision that is placed before them, your premiums are going to go from one small business owner came up to me $670 to first she got it was $2,600. But because they're of the health needs of her family of four, she's small business owners and 2 kids, it jumped to $3,000 right? So those are the women who are going to be having to decide, do I drop health care? What do I do? And then we have to engage with all of those things. The last thing I do before I go around and go is I'm bringing up the story of New Mexico. I'm bringing up the story of New Mexico because I don't know if I've shared it with you. But in New Mexico, we passed legislation to provide that the ACA premiums would be covered by the state. We passed legislation to help our rural health clinics and hospitals stay open. And those two pieces were bipartisan. The Affordable Care Act was, we had only 3 Republicans vote against it in the Senate. So I'm calling on our Republicans to do what they did in New Mexico, which was listen to their voters, listen to their constituents, stand with them, and vote for health care. Now, I forgot to say how, we're going to have, as you all know, you've dealt with us a lot, we're going to be coming in and out as they handle many things, like all women in America, we have lots of things on our plate. And so we will hopefully also, we are, as you know, 96 women strong, and once that Secretary Holloway gets sworn in, we'll be 97. So we'll introduce each of you as we go along, but I'm going to pass it on to Congresswoman Rosa de la.
Thank you so much, dear wonderful friend. Thank you about the New Mexico story. States are doing some very interesting things, but they're going to be in a very tough spot. We know what's happening. But I want to just say for a second, I'm so delighted to have the opportunity to introduce dear friends here at Tanden. But I look at this group of folks here, and when I think of the battles that you have all been through, what you have accomplished on the path, and this session is about women, but what you have done about equality, about justice, about women, about children, and making a difference. And I know that what's not going to happen is you're not going to let it go. You're not going to let it go. And that just really warms my heart. Because I know when you're in a battle, you want to be in the trenches with people who are not leaving, but they're staying. So thank you all for being here. And again, I want to thank my colleague for convening us all here today. We know about the big, beautiful bill, and it cuts to Medicaid, $1 trillion, and its effect on women and children. I was talking with Fatima. 61% of women in this nation are covered by Medicaid. 41% of the births in this country are covered by Medicaid. We got healthcare professionals, 66%. 1/3 of childcare workers are, really relying on Medicare. We're not going to back down, and the district gets into no house party. And I'm here, your wonderful friend here, Tanden. We've been on the same side of issues for a long time. That doesn't mean we haven't disagreed on a number of approaches to doing that, but it's been such a wonderful, wonderful experience. And Neera served as director of the Domestic Policy Council and president of finance. She heard me so many days talking about the child tax.
Yeah.
She said, not another call with her. So anyways, she worked for Hillary Clinton when she was first lady. When she was in the Senate, she worked on Senator Clinton's presidential campaign. It's a deep font of knowledge that Neera has. What I'd like to do is to characterize it this way. She has all of the credentials, the know-how, the acumen to a policy creds to make the fight. But you can do that. What we need to do in this business is to couple that with the strategic ability to know how to get it from A to B. And that's the combination of policy and politics. And it's a delight to have you here today. And the floor is yours.
Well, first, let me say that it is really a profound honor to be with all of you. Obviously, I wanted to say a word about Congresswoman DeLauro, who I think has taught a lot of us how to fight, how not to back down in a battle, how to make change in people's lives. And this is a really powerhouse group of leaders, women leaders, but all leaders. And all of you are people who have made tremendous change in people's lives. And we are at a moment where, unlike at any previous point in my time in Washington, or I think my adult life, where so much is at stake for people. I think the president has a great ability to talk about Greenland or tweet about crazy stuff in life, but what has happened in this Congress has been the single largest assault on working class people in my adult lifetime. And it's a tribute to people in this room that in the first term, you were able to stop him from what he wanted to do to healthcare and the ACA. But because of the ironclad hold he has on Republican leaders, now there has been so much direct harm. And I think what's really crucial for all of us is just to really be grateful to all of you for fighting for people and really holding their stories, right? The truth is, this fight that we are having right now is not about Democrats and Republicans. I mean, you are our champions, so we rely on you. But fundamentally, it is about, the woman in Iowa who has cancer. I'll just name her, Lori Hunt of Des Moines, Iowa. She has breast cancer. She pays $8 a month now for her health care, which is very working class. We'll go up to $600 a month. $800 to $600. That's more than her mortgage and her auto loan. And this is a woman who's really looking at not having health care because she can't afford it. There's a lot of ways these folks try to get us to pay attention to other things. But I just want to say how profoundly grateful I am that you, as leaders, are holding glory in your hands. I think they have been incredibly unsuccessful. Let's be honest. I'm really surprised how much people are focusing. Fact is that people, the public, and all the polling, public shows that they understand the healthcare fight. 75% of Republicans want us to expand premium tax rates. We're not arguing. The people who are not representing their own constituents are Republicans. People get this fight, they understand it. Of course they like the government open. But what's really interesting and insightful is that people think this healthcare fight is as, if not more important And that is because you're holding stories in your hands and because you are really truly fighting for people. They want a process fight. I've been on the other side of these battles, and I'll just say I was in the White House, worried about what the Republicans can do, and I could tell you, nobody knows what a CR is in America. Like, they don't know what it means, but they do understand. This is our opportunity to really fight for working class people, to also make clear who's fighting against working class people and who their champion is. And I just want to say, I know these decisions are not easy. I know what you're holding is the stories you're hearing on all sides of this. Of course, people are feeling some pain. But what we are really fighting for is having a government that is not ripping healthcare away from millions of people. And I'll end with just touching on what Rose said, which is having worked to pass the Affordable Care Act. We know that healthcare is different from every other issue. Why? Because people experience the healthcare system, they feel like they know more about that than, say, energy policy. But also, healthcare is a place where your most personal decisions, the care of your mother, the care of your child, the care of your partner, like, that's what healthcare is. And you are fighting for people to have security in those decisions instead of being thrown to the wolves, which was what happened before the Affordable Care Act happened. And I just want to say, hats off to every person in this room, because the lies around illegal immigration have been proven to be lies. Now they're moving on to just a frontal assault on the ACA. And I say, let's have at it. 70 times you wanted to do it. Let's take the masks off everywhere. And here the mask is. What you really don't like is that people have a hand, just a helping hand to get healthcare. And the fact that you all have moved them to have to pull that mask off is for the first time in 8 months. Let's be honest, first time in 8 months is a tribute. So thank you for holding together, holding strong, and doing what we all are supposed to do. Fight for the nth job, who just needs that help. So thank you, thank you, thank you.
Thank you so much for sort of putting it back in people's actual experiences. And that's why the lies don't land.
Yeah.
Because the truth is they're getting those notices. The truth is their own lived experiences. And I now want to ask our wonderful Congresswoman from Texas to introduce our next speaker.
Thank you.
Representative Julie Johnson, take it away.
Thank you so much. There's 100,000 people in Texas 32 that are going to lose their health care because of this. Mm-hmm. Texas has the largest state of people who participate in the Affordable Care Act. And the Republican policies that have been put out in our state are going to hurt so many people. We already lead the nation in people that are uninsured. After this, if this passes, if they're successful in taking away health care, and then with the Medicaid cuts, almost 15 million people in Texas won't have health insurance. So this is a catastrophic crisis. And there's no centerpiece more than in a family than a mom. And I'm a mom of 2 sons. And moms, we hold it together. And it's amazing the pressure that we have on mothers right now. They're frequently in a sandwich generation, caught caring for kids, caring for parents, and working and holding all the plates in the air all at the same time. And multitasking is definitely overrated. And it's hard. And so I'm so pleased that our MomsRising Ruth is here, and we're so happy that Ruth Martin is here to join us. And we look forward to your work, and thank you for all that you do for elevating women. And one of the things I love about your organization is all of your blogging and all of the enhanced communications that you're inspiring with women, because we just have to break through. And one of my asks for you all is to encourage your network to follow all of us.
Yeah.
We have to do a better job of elevating the communication, and we, many of us at this table, we put out great things. We have brilliant staff, we have some great comms. It gets just filtered into a narrow space, and so I hope that you can engage your million-plus network of moms out there to follow the Women's Caucus, follow the members of the Women's Caucus, and help us elevate your comms game, our comms game, and break through this narrative. So please.
Yeah, absolutely. Thank you for that. I want to echo Neera's thanks to all of you. I know almost all of you are moms, if not everybody at the table. We all are feeling that struggle. And absolutely want to do more of that. We've had lots of conversations with our grassroots and having wonderful conversations with many of you, and they love it. And we know that mom-to-mom communication is really kind of like the best thing to break through all of this noise. So do want to thank you all for having us here today. We are an on-the-ground and online organization of over 1 million people. And to do a little math, it means right now, 1 in 300 people is an active member of MomsRising. So we're very excited about that. And with inflation out of control and prices for food and housing and everything else skyrocketing, the rise in healthcare costs that we're seeing now have become an unmanageable crisis for tens of millions of mothers and families. And so we are glad you're here, and thank you for lifting up your story from Iowa. I have a couple more that I'd like to share with you, so you can take those into your conversations. Brooke from Long Island City told us that the possibility of the ACA enhanced premium tax credits expiring absolutely terrifies her. She didn't go to the doctor for more than a decade because she didn't have health insurance. And she finally got health insurance through the ACA, and that gave her courage to have a child. And now Brooke says, I'm scared. My husband and I are both freelance writers and teachers. We do not get insurance through our jobs. If our premiums go up, we won't be able to pay them. Timpson in Youngstown, Ohio is a self-employed child care provider. She said, I mostly pay for my own health care. I can't afford $800 or $900 a month. I currently pay $125, and that's because of the ACA. I'm a diabetic, and I also have asthma, and the ACA makes my medication affordable. Brooke and Timpson and so many others are so glad that you all are fighting to make sure that we can keep our access to health care, keep our insurance premiums affordable, and to protect Medicaid, including Sarah. Sarah is a single mom from Kalamazoo. She has 2 jobs. Her 8-year-old has a heart condition. Without Medicaid, Sarah's daughter's doctor's visits are cost prohibitive. She told us that she's a widow and money is very tight. So the fact that she's on Medicaid is the only way she can pay for visits and medication. And the loss of Medicaid would be absolutely devastating for her family. And last, I'm going to tell you about another MomsRising member, also named Brooke. Brooke is in Harrisburg. Her 21-year-old daughter has autism and intellectual disabilities. Her daughter qualifies for a Medicaid waiver, and that covers the cost of the adult daycare program that she goes to. And her mom says that she's extremely worried about how that center is going to operate if Medicaid is slashed. The center is worried about it. Her mom's worried that these cuts are going to lead to higher rates of isolation and institutionalization for people with disabilities, and she's very worried about what's going to happen as she gets older and is not able to care for her daughter the way that she does now. As you know, Medicaid and ACA have been absolutely lifelines for hardworking families, allowing people to build good, healthy lives, to contribute to their communities and contribute to the economy. And the Republicans in Congress trying to take that lifeline away to pay for tax cuts for billionaires is hurting our families and our economy alike. So again, I want to echo Neera's thanks and everybody's thanks for you all holding the line. And we are here to back you up with 1 million moms behind you. So thank you.
Thank you very much. And what this is about the number of moms is how, it's my understanding it's growing. Right? Moms want to do something, they want to get involved, and what you are offering, and what I think we're all offering, from following us to showing up to my good friend Deborah Ross's statement of let's all live the First Amendment and get up and pray, have freedom of speech, freedom of assembly, all of that good stuff.
So with that, I'm delighted to introduce President Protector and Woodhouse.
Great, thank you, Dr. Morrison. And this is not the first event that we've done together. In addition to fighting for affordable health care and trying to preserve Medicaid and the Affordable Care Act, we talked about the public health consequences of Secretary Brainword, and a habit that he's redone public, public health. So we got a lot of healthcare challenges in this country. We can't forget about those. But let me start by saying, no one knows better than you all how important healthcare is to women. In fact, one of the things that we really rallied around in passing the Affordable Care Act was ending the discrimination that women face in healthcare. Being a woman was a pre-existing condition, and women are caregivers. Women more likely than moms more than dads are more likely to take their kids to the doctor's office, more worried about how to make that copay, how to make that premium payment. And so attacking the Affordable Care Act again. And I agree with Neera. I mean, so now they're just out attacking the Affordable Care Act, and they're as opposed their lies didn't work. So that's one thing to know. In all the data that we're seeing, this includes the fight over the passage of the Big Ugly Bill. They trotted out these same arguments about undocumented immigrants, and they're not working. They're not working. Remember, they spent all August trying to reframe this. They went after undocumented immigrants. They talked about how they were rooting out waste, fraud, and abuse. They talked about how they were strengthening Medicaid, and then they came back. And Donald Trump said, "You know what? We need a new message. We need a new brand. We need to relaunch our brand." And so they want to talk about tax breaks for the middle class. So we know the lies don't work. So we don't get sucked in to those arguments. I mean, what y'all have done with putting healthcare in the middle of this crisis, like I never said, no one knows what CR is. No one knows what an omnibus is. What we're seeing is in the polling that Democrats are winning shutdown fights. So just on the generic question, who do you blame? They blame Republicans more by double digits, 10, 11, 12 points. But Democrats have a much bigger advantage on health care than we are winning on the shutdown fight. I mean, we've got 90% of Democrats, 75% of Republicans, 85% of independents want to see the premium tax credits extended. There's massive support compared to where we were when they started going after the Affordable Care Act in 2017. For the Affordable Care Act, there's even more support for Medicaid. So that they're just increasingly touching what is becoming another third rail of American politics. Every day that we increase our advantage on trust, on health care, and we increase our advantage on who's getting blamed for shutdown, is a great day for us. So stick with it. I mean, I get it. I come more out of politics than I do out of health care. So if there was another issue that I thought Democrats could win the shutdown battle over and actually achieve real important results for the American people. I mean, just imagine if out of this we actually get the tax credits extended. That'll help 20 million Americans. That'll actually have 24 million Americans. 20 million that would see their premiums go up. That would help another 4 or 5 million that would choose not to have health care altogether. So, but if there was another issue, if it was tariffs or authoritarian takeovers of cities or whatever, I'd say do that. But this is the right fight. This is a fight that unifies Democrats, and it is an issue that unifies the American people. So it's the right fight. It's the right time to have it. I mean, ignore the process. Ignore the BS coming. They want to bait you in the process. Bait you in to undocumented immigrants or waste, fraud, and abuse. I mean, in Medicaid, for example, they have $1 trillion of waste, fraud, and abuse in Medicaid. There's not $1 trillion of undocumented immigrants getting health care out of Medicaid. It's all bullshit. And the American people know it. And that is why these arguments have failed over and over and over again. So now they're recycling age-old arguments against the Affordable Care Act. And I think it's important. This is the Affordable Care Act and it's Medicaid. The combination of those two gets 15 million people who will lose health care altogether, and millions more will see premiums increase. But I think the other important thing here, everyone I think so far has talked about is stories. It's stories. It's not about process. It's not just about healthcare. It's not just about numbers. So here's a Georgia story. Teresa Acosta, she is a small business owner in Georgia whose premiums are going to triple as her son's diabetes treatment prices cost skyrocketing. She knows this because they're window shopping in Georgia already. They've been able to compare rates, and as a result of the GOP healthcare crisis, she's closed her small business. She's looking for a job that provides employer-sponsored healthcare, but she will not be able to afford the premium increases. Or there's Chelsea Baker off Colorado. She lives with multiple pre-existing conditions, as does her husband, and they are going to probably make the choice not to get healthcare because they can't afford the anticipated premium increases. I mean, KFF, y'all seen this. We're talking about doubling. That's what they said on average. But we've seen in some of the window shopping in Maryland, we've seen that some people are going to have their premiums triple as a result of this GOP manufactured healthcare crisis. Manufactured with tax breaks up to billionaires, and manufactured because they hate Democrats and they hate Barack Obama and they hate people getting something, getting what they would call a handout from the government, which is, I mean, my God, talk about handouts from the government. I mean, just look at what they're doing with their tax policy.
Qatari jets.
Yeah. Yeah, I mean, for private jets. So the American people get it. The stories are so vitally important, but it's not just the state tax rate, it's Medicaid. One of the things we're tracking, I'll just real quickly at Protect Our Care, we have a thing called hospital crisis watch. And so we now have tracked over 500 healthcare facilities. So this is hospitals, it's community health centers, it's Planned Parenthood clinics that have either said they're going to close or threatened closing or downsized. But what's the first fucking thing they downsize? Maternity. That is one of the first things to go when they say, okay, we don't want to close the hospital, but we got to close something, so they close maternity. Then they close the emergency room, and then they may close altogether. The day this bill passed, it was sent to the president. A hospital in Nebraska announced that it was closing. A hospital in North Carolina that was going to reopen because of Medicaid expansion there said, nope, can't do it, we're not. And now we're up to 500 that we are tracking. Look, this is the right fight. This is the right fight for families. This is the right fight for women. It's the right time to do it. We're going to win the shutdown fight. We're going to win the healthcare fight. And y'all are going to be the fucking majority in 2026.
Amen.
Yeah, absolutely. I'll get it.
Will you send the list of hospital closures?
Yeah.
We could all go and have some dramatic presentations.
Oh, yeah, absolutely.
Very good. That'd be great, and we'll make sure that all the members get because CAP has amazing stuff, MomsRising, we like to see that, look at all that. And since you mentioned North Carolina, I'm gonna turn it over to our colleague from North Carolina, Representative Goss, which is our next speaker.
And thank you for all the work that Protect Our Care does in North Carolina. When we get a chance to ask questions and tell stories, I have 2 stories from North Carolina. One from a Protect Our Care event that was very, very successful. But it is my distinct honor to introduce the best for the last speaker, President of the National Women's Law Center, Fatima Goss, who is the power and the justice behind our cause. So, floor is yours.
This is a fairly exciting.
Well, I am so pleased to be here, and thank you, Representative Ross, for the introduction. And I'm sitting across from all of my heroes right now because you all are in this fight and this. I'm Fatima Goss. I am president also of the National Women's Law Center's Action Fund. And I have to first start off and say what it means to continue to hold strong against a bill that is not only partisan in how it is funding, but that will harm millions of people. And doing it in the face of lies, doing it in the face of rhetoric and doing it when your colleagues aren't even here. So you continuing to hold strong is inspiring all of us at a time when we are now more than 8 months into unrelenting attacks on women and on their families. We talked a lot about the big ugly bill and what that has meant in terms of the cuts to Medicaid. But also the defunding of Planned Parenthood. So hospitals announcing they're closing, Planned Parenthood centers will have to close. None of that is going to make women more healthy. None of that is going to make communities more healthy. And I want to take a step back because there are about 10 million women who are enrolled in the Affordable Care Act marketplace who use these subsidies every time. About 10 million women. And what does that translate to when they're able to actually have health care? It means that they're getting the benefits. It means that they're able to show up for that wellness. It means that they're getting to show up for blood pressure checks and their pastors and all of the things that people were skipping because they were having to make a choice between, do I get health care, do I see the doctor, or do I put food on the table? It's outrageous to hear about people's health care not doubling, not tripling, going up by 10 times on purpose. The other thing I want to just name, because I cannot miss the real serious impact the shutdown is also having on the civil servants who have dedicated their careers, their lives, they're hard working every single day. There are nearly 1.1 million women federal workers, and they make up the majority of the federal workforce. And they're disproportionately targeted in these staff reductions. And part of that is where they're working, right? The Department of Education, for example, 65% are women. And they have furloughed nearly 9 out of 10 of their employees. That's outrageous. That's not how this administration should work, and Congress has a job to do here, right? So you're here doing your job, right? You are here doing your job. Your colleagues on this in action. It also, I have to name that when we looked at the numbers, we noted that Black women are disproportionately impacted by these violent crimes. Black women make up about 6% of the total workforce. They come from more than 12% of the workforce. So we don't think it's an accident what's happening. We see this as an extension of ongoing and absurd attacks. Listen, cutting off vital assistance for families, firing a vast number of working women in the federal government. This is an effort to systematically undermine the economic security of women in this country. And it will show up for them, it will show up for their families, and it will have an effect in their communities. So there are solutions to this chaos that you all have named. They gotta cut this vacation short. The House Republicans have to cut back. And action sit at the table and get a solution for healthcare in this country. And if there's anything that has shown us that we need some guardrails for this administration, it is this. It is outrageous. And so you all are the guardrails, you are the fighters for us all, for our healthcare, for our economic security, and for our future. So thank you for what you're doing. Thanks for having me.
Thank you, and I'm going to open up to the members for questions. Because each of you, it's about pre-existing conditions and how coming back, right? Because people are going to not be able to afford health care, so they have pre-existing conditions. We're going to kill them. It's 42,500 people are going to die because of these policies, which we need to remember, and we know what that looks like. We've all seen somebody die that we love because they haven't gotten access to health care. And so it's the getting kicked out, it's no health care, it's reduced health care, it's all of it coming back, and you all put it together so beautifully. But I'm going to open it up to our members to see if they have any questions. And the first hand up is Lucy. And then we'll go to
are closer to the ground, you know what's happening, we know what's happening within our districts, but you know about the representation of the large number of people in your organizations that are doing the heavy lifting and the work on the ground all over the country. You're hearing firsthand, so thank you for giving us this really good information. I represent Georgia 6th Congressional District. And we're actually very aggrieved here that our Republican colleagues have decided, as we've been saying, to stay away on vacation. They're not here doing the work of the people, and of course, the implications of everything that is happening. Healthcare out there is so vitally important. I too have been in the system as a two-time resident. So, you know, I understand what needs to be in the system, and I was someone who had access, still has access to really good, important, quality healthcare. But I keep thinking about every day women that I've met around my district as I travel in my district that are on Medicaid, that have been talking to me about the fact that they are now either in remission or they're currently in some state of care for all kinds of conditions that they're suffering by, and they're so scared to death they're not going to be able to get the health care that they need. A recent study released this summer showed that women are leaving the workforce in record numbers. And working women are often mothers. We know that they're caring for children and caring for their family members, while they're also serving as caregivers for a number of people. How does the Republican budget bill impact working women who are also serving as caregivers for their family members? Because we know what is about to happen with the caregiving industry. Another little quick story, because I know we have a lot of questions.
Yeah, actually we could because we have other women.
Right, yeah. So I have that same situation in my family with my mom now. And she's in a nursing home. And she's screaming and yelling about the kind of care that she's been given because the woman that always works with her has lost her job. So how does that affect what we're about to see that is going to happen in the caregiving industry?
Yeah, if I could just say quickly that Medicaid
Shutdown is.
It's on message.
Medicaid pays for the majority of person in this country, is also the majority payer who care for anyone, who care for our elders and those who are disabled. And so that level of gutting is for sure going to have an impact. And the math does not math. People are not able to just make it work and figure out this problem on their own. The third payer is what we need to ensure that your aunt and women and families around this country actually are able to get the care they need. And assuming that women can just do an unpaid burden of care, that's not a solution. It hasn't worked in the past. It won't work in the future. And so this will drive for more women out of the workforce on top of the women who have been carelessly fired from the federal government and are left without the security that they need.
Thank you. I'm assuming that was the answer that I was going to get. I was hoping it would be something different. But, so I just want to thank you for that, and thank you for verifying that, and it's good for everybody who is able to know this is happening out there in the streets.
Thank you, Lucy, and thank you, Jim. For everybody who doesn't already know, that Jill took that from Hawaii.
Aloha. Thank you so much for being here. And my perspective has often been from rural and remote America. We've had some conversations earlier about this. I co-founded and co-did the Bipartisan Rural Health Caucus. Many of the members on this table are members. We have over 70 members of Congress, Democrat and Republican. We agree that there's a problem. When I sit on the beach in Waianae, and an uncle looks at me and he points that way towards the city and goes, how come they live 10 years longer than we do over here? And there is no right answer, there is no good answer. When you consider the fact that, more than 19 million women live in rural America right now, and if you think about rural America as a whole, 1 in 4 rural Americans rely on Medicaid. That's over 16 million Americans right there. I think we touched upon it a little bit as well in terms of women. Maternal mortality and morbidity rates are usually 38% higher in rural America. When you think about our hospitals, that we have 46% of rural hospitals are already operating the red, likely over 50% with all of the changes that came in with the big ugly bill have pushed them over that edge now. Since 2005, we've had close to 200 hospitals in rural America close or convert. And as you said, Brad, that number is only increasing in terms of those that are having to make some serious decisions about which ward to close. On Maui, I had people rescinding offers to OB/GYNs, and we can't afford to do that when I have women on the night who can't even give birth on island. They rescinded it because they said, I don't know that I can make payroll for the kind of Medicaid cuts that are coming through. And so when Republicans talk about supposedly representing their people, speaking for their people, and yet they literally, from rural America, have ripped away $155 billion in Medicaid funds. They throw a $50 billion small-ass bucket for the Rural Health Transformation Program. That's nothing compared to what they have literally ripped out of their hands. The healthcare, the ability to have providers stay open, hospitals not close their doors. This is absolutely inhumane, unacceptable. And one of the questions I guess I have for you in this moment now is, how do we give voice to the voiceless? The voiceless is all those Republican districts who have people worried that they will die because they lack the health care they need to survive, to take care of their children, to take care of their aging parents. How do we effectively, we're giving voice to our people and our stories. How do we help give voice to the voiceless, for the ones whose members can't even bother to show up to work here in Washington, D.C.? How can we work with you to do that? Because right now, I am spreading all the stories I can about Hawaii, but I'm worried about Alabama, Utah, Texas. I'm worried about a lot of other places across this country where people are scared, people will die, and right now their members can't even show up to them.
Well, I'll tell you one thing that we've seen has been very effective, and Rakata has done this, Republican does. Go to a town hall in a Republican congressional district.
It was really effective when we did that.
Go right into a Republican congressional district and put the stories of that member's constituents front and center, and get them on the news, get them to creators, get them to influencers, and really tell those stories. That's the other thing, is that we have to aggregate. That's one of the things that we do, and I know the CAP does really well, probably every organization here, is aggregating stories of people. And look, we know the stats, the disproportionate impact of Medicaid cuts hurts rural America. Most of the ACA tax credits go to rural America, and most of the ACA tax credits go to Republican congressional districts. So we've got to hold their feet to the fire. But I say lift up stories from other districts, go to town halls in other districts. I mean, it's one of the things we're constantly trying to do is find stories. I mean, we're looking for stories from swing Republican districts to use in a variety of ways, as you might imagine.
In fact, we're actually doing that with you all. We're working on setting up, MomsRising is working on setting up a field hearing in rural Pennsylvania in November, and inviting many of you to come join us and hear directly from those constituencies when representatives are not there.
I don't think, oh, sorry.
I was thinking, can I just put a plug in to try to do some virtual?
Oh, yeah.
Some of us do it in the middle of the ocean.
Yeah.
So it's a little farther for me to get to rural Pennsylvania, as much as I want to do it there.
Definitely. The only thing I'd say is, when we were going through the ACA fight, the impact on rural communities was really front and center, and really cleavage to a lot of Republicans who felt pressure. So, this was a strategy that passed this bill quickly, and you can tell how much the president is proud of this legislation. The BBBA Act, since he's never mentioned it again, and immediately moved to the National Guard instead of campaigning in the country on this big beautiful bill, which he has to change the title of because it's so pernicious. So I think the thing that we really want to emphasize is that they would like us to talk about everything but the consequence of that legislation. And what we are doing at CAP, and I know many others is really hyper-focused on communicating about the impact of this legislation. When a clinic closes or when utility rates go up, that is not just something that happened, right? Or the premium tax rate, it's not like the insurance system was against you. That was a conscious choice of House Republicans alongside this president to cause harm to your family. And we have to religiously focus on that. I know that there are a lot of threats, and it's reasonable for us to take on a lot of threats. But what they want us to do is talk about everything he's talking about instead of everything he's done to people. And that is like what we think is crucial. Every month, I will say from the other side, when I was in the White House, they have a campaign every day. It does not start in September of election year. It is a campaign to drive disconnect between the administration and the voter, whether it was us. They have done so much incredible harm that they want people to think about everything itself except that harm. So that's our job.
Campaigns are repetition.
Yeah, repetition.
You did not get tired.
No.
You may figure you're boring yourself.
And it doesn't matter online, it doesn't matter if reporters are bored by the story, you can keep telling the story.
Because they don't get it.
Yeah,
They don't.
yeah, they
It's
don't.
very frustrating.
Yeah.
So, and as we've been working with MomsRising, please, all of you, the Democratic Women's Caucus, we are resources to each other, we're in this together, so reach out because we will let our membership know. You know, we're working on getting that one, we're gonna be going to North Carolina. We have time for one more question, anyone down here want to ask a question? You want to follow up? Well, so did,
I have a rural
But you
story
will
to tell. I'll just tell the quick rural story that can
go back,
rather than ask a question, since everybody's asking and Jill's asking, in a Republican district. And we got some really, really great press on this in North Carolina. It directly goes to the tax credits. So there's a woman named Lee Carlton, who's a resident of a rural mountain community in western North Carolina. She suffered multiple strokes and lives with ongoing complications. Without the enhanced premium tax credits, her insurance cost will be $30,000 a year. And she told this to me plainly. We did a press conference virtually, Jill, so you can meet Lee if you want to. Without this coverage, she would have died. Furthermore, she might not have made it to the hospital at all because the facility that treated her is at risk of closing because it's in rural, mountainous North Carolina. And if that facility closes, it will be 1 hour to get to an emergency room. And so she testified. We had a great press conference with her last week to talk about the real consequences in a Republican district in North Carolina. So thank you.
County, but you want to cry as well. If we're going to go back down to this, Kelly, do you want, why don't you close it out, and then we got to get to the press conference because we only have, we've got press conference, so we have to be there on time, and then afterwards, the individual who wanted to give short statements, and then we'll have to hear from them.
Yeah, so just more a comment than a question. I think you were at bringing up hospitals, because one of the cases that I'm trying to make to people in my district is that yes, the most vulnerable people are going to be decimated by this bill, but it is going to impact everyone because hospitals are going to close, clinics are going to close, everyone's going to have less access, everyone's going to pay more, we're going to be less healthy as a country. When half our births, or around half our births, are Medicaid births. We talk about workforce shortages going forward. What are we doing? And so I think it's really important. The helpful example I have right near my district is HCMC, which is one of our big county hospitals. They took the mass casualty event that was the Annunciation Catholic School shooting. They took in all those kids and put back together their bodies. And I think people in my metro area, but like, what happens to them if HCMC is no longer there? So I think,
Please don't forget the disabled, Medicaid, children's
Yes.
low-income workers, and seniors. I did a session with families of disabled children. It is the most heart-wrenching effort. This is their lifeline. Their kids die without Medicaid.
Who cares for disabled children?
30 seconds. I was going to take 30 seconds to say, I want to share a very brief story, and it will be in 25 seconds. So when we were going through the ACA fight the first time. A man came up to me, we had a rally on the steps of the Capitol. A man came up to me and asked if he could speak to me. He was, a person who looked like he had lived a hard struggle life. He was like in his 50s. And as we go to the side, and he starts unbuttoning his shirt, which was an unusual thing to do, right? But I wanted to hear from him. He seemed a little nervous, and he said to me, as he was unbuttoning his shirt, that he had never had health care before in his life. And he'd never gone to a doctor. He was a truck driver who's on contract, never had health insurance until the ACA. And he went to a doctor for the first time, and he was unbuttoning me to show me that the doctor had told him he needed heart surgery or would die. So he had bypass surgery. And if he had not seen that doctor, he would not be alive. So he drove 3 hours because people in this room led a fight to give people health care that meant that he was alive. And he was a Republican, but he came because he wanted other people to live. And so when you fight for health care, you are fighting for people to live. That is what this fight is about. So I want to say thank you for those who passed the ACA, and thank you to all of you for fighting to keep us.
We want you.